My name is Dr. Cornelius Muendo. I'm a public health officer, and currently I'm a lecturer at Chuka University, where I'm also the head of public health section. And before joining the academia, I worked as a public health officer for close to 10 years in Tharaka Nithi County, where at one point I was in charge of school health, the district school health coordinator. At some point I was in charge of community health strategy. I was the county community strategy health focal person. Then before I left the county, I was the county public health officer. Then before joining the county, then we were in the Ministry of Health. Worked for about 1 year before we got transited into the county system. And before then, I had an opportunity to work in the private sector and also in the non-government organizations. Yes. Yes, that's a good question, and I'm very happy today we're having that conversation, because most of the times we talk about professionals, we focus so much on the professionals, the people that are practicing, but we never look at the industry that produces these professionals, which is now the academia. And there is a lot which needs to be done in the academia. There is a lot that academia contributes towards getting the right professionals. In your case, about the question about a resilient public health system, one maybe just to unpackage, when we talk about a resilient public health system, this is a system which is very prepared. We need to have a system which is always prepared, a system that is ready to respond, and system that is ready to recover during times of shocks. Now the question that you're asking is, how now can the academia contribute towards having such a system? A system which doesn't collapse at the face of a single shock. What we need as an academia, one, is to have a responsive and a proactive kind of a training, whereby we get the right curriculums. And we are very happy because at the moment we have a regulator, the Public Health Officers and Technicians Council, which is trying to set the standards of training. Though we are not yet there, but I can say at the moment where we are, it's far much better than where we were in some years back. So to some extent, we are doing something. Then most importantly, it's about now aligning the training to the contemporary issues. We know public health has changed. The public health of 1980s, the public health of 1990s, the public health of 2000, the public health of 2010 is not the same public health of today. Public health is changing. And when we talk about this change, one of the key changes, it's now we are moving away from a human focus, because to some extent we have paid a lot of attention to the human focus, whereby we center the interventions to the humans. Now we have a One Health approach, and that is what we want to promote, where in public health we look at it holistically, whereby we are focusing on the human health, we are also focusing on the environment, and we are also focusing on those other things that contribute to health. Because when we look at health is somehow, it's truly diversified. You cannot attain health when you focus on the humans alone. You want to focus to the animals, because at the moment, when you look at the emerging diseases, most of the emerging diseases, they are as a result of spillover. Like we talk about the COVID-19, we talk about even the HIV, we talk about diseases like the Ebola, the SARS, all of them. When you look at the genesis of these diseases, they have spilled over from the environment, from the animals into the human beings. So we cannot really talk about a public health where we are not focusing on the environment, where we are not focusing on the animal health. So we need to have a system that is holistic in nature, focusing on the one health. And number two, we have to some extent, like I started by saying, we don't pay a lot of attention to the trainers in the universities, because we cannot have a competent public health officer when they are not being trained by the right people. And that is something that, again, we need to start talking about. Like, for example, I've been in the academia for some time, and I also interact with people that are in academia. You get someone, and this one I say at the risk of maybe being antagonizing some of my colleagues, you get someone, like for example, someone has never practiced as a public health officer, yet this person is now training the public health officers. We need to have a system where we can have programs that are targeting the trainers for these students, for these professionals. Because, like for example, when you talk about contemporary matters, then you get a lecturer who was trained in 1990s, and they are using that knowledge of 1990s. They have never practiced. They are not doing anything to update themselves to train these public health officers. In fact, what I would recommend, just like what happens in the medicine, when you look at the medicine, for you to train as a lecturer, you must also practice. You must also practice, because what you are training must resonate. It's not about giving the theory. You are supposed to put the practical context in this student. And that is, to some extent, that is somewhere we have failed for some time. I would recommend, and particularly in these health-related courses, if you are a lecturer, why can't it be that for you to continue training, then you must be, to some extent, you must train, you must be practicing. Like for example, a lecturer, I'm training issues of food safety and quality. Why can't I also be given an opportunity to go and inspect food premises, so that now I get the real experiences, so that I get now the practical aspect of it. So that is something perhaps that we might need to think, that we might need to focus. Something else how the academia can contribute. When you look at the resilient public health system, a resilient health system, there are some pillars. There are a number of pillars. For us to attain that, there are a number of pillars. I'll focus on 3 pillars that are very critical to us in the academia. One of it is the right professionals, And that is where I'm saying we need to have a curriculum that is updated. Like when you go in these academic institutions, most of the times we have a cycle of revising our curriculum. And this cycle comes after every 5 years. Can't we reduce the 5 years? Because within 5 years, so many things happen. You can attest to this. The world is evolving very fast. Public health is evolving very fast. So if you have to wait like for 5 years for you to revise your curriculum, you can imagine the disservice that will have done to the public health, to the trainees. Then again, another focus, it's on in terms of research. And in the line of research, not only the lecturers, but the students. We need to make sure whatever we are carrying out as research for public health really resonates with the real public health issues. I want to tell you, I supervise students, the postgraduate students, and the undergraduate students. And most of the times, whatever they come up with as their thesis, as their proposals, you realize most of the times they are too much into clinical. A person who is pursuing a master's in science in public health, you look into the things that they are doing, their interest is so much into the clinicals. So that is an area where maybe we need to have a conversation. We need to have a forum where we can mentor the professionals, where we can highlight the priority areas for research. There is so much that can be done in public health, matters of solid waste, matters of food safety, matters of environment and climate change, so much which is truly public health. And for us to attain that, and I like what the union has started doing, we need to come up with a plan that outlines the priority areas for research in public health, not only for the professionals, even for the academic institutions, even for the students, so that as they select their titles of study, they can somehow be guided towards a particular direction. That's something else as I wrap up on that question. It's about now the priorities and where we need to put some emphasis when we are training these our students. We know at the moment the world is going digital, and we have what we call the digital health and artificial intelligence, the digital health and AI. We need to prepare our students in a way that they possess the right knowledge, the right skills, the right competencies, the right attitudes in terms of digitizing the public health practice, the public health interventions. And most importantly, we need to make sure we trigger these our students to become very innovative. There is so much we can do in public health. And most importantly, and this one is a challenge that I want to pose to the practicing professionals, the leadership in public health. The question is, in this era, why should we have to wait for an entire 1 month for us to analyze reports for public health, for us to act? Why can't we have a system whereby these reports can be taken up every day, analyzed every day, then we come up with interventions that are very responsive, real-time interventions, because we know how diseases occur, even how outbreaks occur. Sometimes we have a window, we lose so much, we have an opportunity that is lost. And this opportunity, it's basically the opportunity which is lost because we delayed so much before analyzing the data for us to get the insights from that data. So that is a challenge. Why can't we focus on that? So that anytime you report a public health in a certain village, they have collected certain data, they are able to report while still in the field, and this data is able to be analyzed, aggregated, then analyzed in the same day, and the information is just channeled everywhere. So that way we become proactive and we are on top of things. We are not caught flat-footed. So that is what I can say basically on what we need to do as the academic institutions and how we can contribute. Thank you. That's a very important question, a very critical question. And truly, we need a mindset change. We need to change our mindsets. We need to have a shift on how we implement public health. The public health of yesteryears is not the public health of today. We cannot use the minds of 1990s. We cannot use the minds of 2000 for us to implement the public health of today, because public health is rapidly changing. Among the professions that are changing, one of it is health. Of course, the ICT is taking lead, but you find health is somewhere. We are rapidly evolving. So we need to have a mindset change. And how can we have this mind? The things that we need to do. One, I need first to focus on the professionals that are practicing. One, we need to have a concept that has been employed in medicine for so long, what we call the precision medicine, whereby in the medical field, interventions are tailor-made to suit the needs of the patient. They look into a number of things: the genetic makeups, the genomes of that patient, the lifestyle, and so forth. And so, because people are not the same. I want to tell you, like, for example, Wairimu, with your sister, you are not the same. There is what we refer to as biological variability. And that is the reason why you can walk in a restaurant, you take the same food, yet you contract diarrhea, and someone else who took the same food, they don't contract the same diarrhea. It is the same case when you travel in the same bus with someone who has COVID-19. Some people contracted COVID-19, others did not. That tells you we are not the same. There is what we refer to as biological variability. So we need to embrace that, the concept of medical precision to public health, in the concept we call the public health precision, whereby we need to have interventions, and we truly mean it. We have interventions that are tailor-made to individual needs, interventions that are customized to particular areas, and this way we are going to save a lot of resources, because we just make sure we channel the resources in terms of the technical competencies to the right people, to the right geographical area. That is number one. And number two, in terms of the technical realm. Number two, there is a lot as public health. I want this one to be very particular to public health professions, to the public health officers, particularly those that are working in the government. There is a lot that needs to change. Number one, we need to start doing things in the right way. We need, like, for example, to stop complaining, then start working. We know there are challenges everywhere, and it will never come a time, even in our homes, it will never come a time when we shall be able to have everything that we need at our disposal. So we need to stop complaining and start now working. We cannot have the right practice when we don't possess the right skills. The only way you can possess the right skills, the right competencies, it's by you going back to class, or not necessarily going back for class to get a degree. You can go, there are so many professional courses that you can pursue. There are so many online trainings that you can attend. And of course, there are very pertinent issues. Like, for example, you don't expect the disease surveillance. Someone who was trained took a unit of disease surveillance, for example, in 2000, in 2010, in 2016, or even in just recently, and they have not updated themselves. You don't expect them to practice well in disease surveillance. So we need to take it upon ourselves. Let us keep updating ourselves. I want to tell you, I practiced in the county in leadership positions, and I can tell you we have serious technical gaps. Even how to write a report, we need just to appraise ourselves, to update ourselves, so that we can do the right things at this right moment. Things have changed for long, so much. Another mind shift, a mind change that we need to have to embrace, is to make sure we stop complaining all the times. Let us, not only the public health officers, we know there is so much that we don't have. We know there is so much that we need to be facilitated. But at the same time, we cannot say we have zero support. And what I want to call upon to the public health officers and other health professionals, we are the ones who need to demonstrate to the county governments, to the leaderships, that we need some support. If we can, the little facilitation that we have, if we can be too efficient, we have so huge outcomes from that little facilitation, then that can trigger the governors, can trigger the leadership to support us even more. It's only that we are not creating demand for that facilitation because they are not seeing our relevance. It is for us to create our relevance. And that will happen when we shall stop complaining, when we shall stop being crying babies, then we start using the little that we have. Like for example, I used to challenge my public health officers when I was in the county. We talk about poor sanitation. You talk about you're not having a support to carry out inspections, yet when you are coming to work, you pass through a particular town. Why can't you make sure where you can walk, you perfect in that area where you can reach by walking, so that now you can demonstrate to the leadership that if you are given some facilitation in terms of transport, you will also be able to perfect those areas where you cannot reach by walking. So those are some of the things. We need to do what is within our capability so that we can demonstrate, given some support, we can do so much. So that is a call for public health officers, not only for public health officers, but for all health professionals. That's a very good question. And that's a good question because in public health, we have a leadership. We have a leadership which has a certain governance structures. And we need to respect these governance structures because every structure is there for a purpose. Every structure is there for a certain mandate. And one, even before I go to those mandates, we also have the people that are in those leadership positions, in those structures. Like for example, the association, we have the people that are in those leadership positions, the PHOTC, the union. What we need to start by doing, one, is to make sure we have the right people in those structures. And how do we have the right people? Is to get someone who is selfless, someone whose the interest of the profession, the interest of others prevail upon their personal interest, so that they don't bring their personal interest in those structures. Then we need to have people that will respect the fact that a certain structure has a certain mandate and they are supposed to stick to their mandate. Like for example, we know the union is there by law to protect the right of the public health officers, the rights of the professionals. Why can't we respect that? We know the council, the Public Health Officers and Technicians Council, it's there to regulate the profession, to create demand for the profession. Why can't we respect that? Why can't they stick on their mandate? We know the association has their mandate that are separate from the association of the union. Why can't we have leadership that respect their mandate? Because this kind of encroachment, they want to encroach on others' mandates, that is where conflict begins. And I want to tell you, if we could have a union that works with the regulator, the Public Health Officers and Technicians Council, and that works with the Association of Public Health Officers, and all of them, they work in synergy as one team, I'm telling you, public health is going to achieve wonders, because every structure will come in with their own mandate, and there'll be a synergy because they'll be speaking with one voice. Yes, it's good because we cannot have them agree on everything, but let those disagreements happen in the boardrooms. And when they come out, let them have one position, let them promote one position, because we know, all of us, the interest of public health is to prevent disease, is to promote health, is to protect the lives of people. Nothing more, nothing less. And as I finish, we need also to embrace a culture of telling our stories, a culture of telling our stories. And this is a culture that to some extent I can tell you we have not done so well. But I'm very happy, like in the union, I can say they have a person who is dedicated to telling the stories and so forth, the what we do. We need to tell the community, we need to tell the world what public health is doing. And I want to tell you, if we don't tell our stories, someone else will tell our stories. That is the reality. If you don't tell your story, someone else will tell your story. Because nature disgusts vacuum. Nature abhors vacuum. There are people who think if you don't tell your story, that story will never be told. That is wrong. That is not correct. If you don't tell your story, someone else will tell that story. And when they start telling that story, they'll tailor that story to suit their interest. So it's very important we cultivate that culture, we nurture that culture of telling the stories. There is so much we are doing as public health. We need to make the world understand what public health is doing and what public health is all about.
Thank you so much for the insights. And from your perspective, what defines effective public health leadership, especially in times of crisis, pandemic?
Yes. Effective public health leadership, it's about a number of elements. And I'll focus on the very critical elements. And the first one, which I want to repeat, which I want to emphasize, is selflessness. It's selflessness. When you are in a leadership position, that position, it's not about you. It's about the people that you are leading. It's not about your personal interest. Let us have a leadership which speaks to the needs of the people, not about their needs. Let us have a leadership which has public health at their heart. Public health at their heart, so that in the event where they have some conflict, the public health will always take precedence. Another very important, let us have leadership that has some sense of integrity. I want to tell you in terms of pandemics, there has been a lot of, sometimes take that as an opportunity to do all bad things, all sorts of bad things. Talk about corruption, talk about this and that. They also take that opportunity to reward their cronies, to reward their friends. Let us have leadership that is defined by integrity. Those that are ready to do the right thing during the day, at night, and wherever, regardless of whether someone is watching them, regardless of who is watching, or when they are being watched and when they are not being watched. That to me is what defines effective leadership. And most importantly, you cannot be effective as a leader when you do not possess the right technical know-how. And that's where I want to challenge everyone and those people that are in leadership positions. I want them to take a leave from our former director, the Dr. Kepo Bacho, the Dr. Mwitari. These are people who took time to invest in themselves, to get in the right technical competencies. And they demonstrated that by attaining their master's degree, their doctorate degrees, and so forth. And I want to tell you, with such kind of a leadership, with such kind of a leader who is technically competent, even when they go to articulate their issues, I want to tell you, even the minister will listen to them because they know what they are saying. Have had an experience working in the county, and I want to tell you, anytime your seniors realize you do not have anything to offer, they don't even listen. They don't even care to listen to what you are telling them. Even sometimes you might be having very nice ideas, but because they already formed up an opinion about you, they just despise what you are telling them. So we need to invest in technical competencies. That to me is very dear. And I want to tell you, and this one is about public health. We have complained so much that public health officers are not given leadership positions in AFYA, in the counties, and in so many institutions. But it is because for us, it is just the other time when we started training degrees. Just the other time when, and those people that have PhDs, they are accountable. Those public health officers that have masters, they are accountable. And the question is, if someone who wanted to give a leadership position, we have someone who has a diploma, because that has been the case for so long. Most of the public health officers in the leadership positions, their highest qualification for so long has been a diploma. Someone has a diploma, another someone who is a doctor has a degree. If it were you now giving a leadership position, will you consider someone with a diploma or someone with a certificate, or will you give it to someone who has a degree? So that is how we have lost for a long time. It's an historical injustice, but it happened because that time we never possessed the right papers. During the times of Kepo Bacho, things started changing, and doctors started listening to Dr. Kepo Bacho because now they started seeing him as their equals and even their superior, because he had much more academic qualifications than them. Look at Dr. Mitari. They used to listen. Anytime he talked, they could listen. And I'm telling you, having worked in the county, sometimes people, when you stand up to talk, they also analyze you in terms of what you obtained, and most of the times they are biased towards the academic qualifications. So that is a clarion call for all the public health officers. Let them go back to school. Let healthcare workers get back to school. And there are some positions like the other time I was in the county, and some counties we are giving the disease surveillance coordinators to other counties. And you see, sometimes we create demand for that. Because if they look at the people that are in the county, you get someone who has done a master's in epidemiology, who may perhaps belongs to another country, and someone in public health, we do not have a master's in epidemiology, then sometimes they can justify why they are giving that other person, because if it's about disease surveillance, it's about epidemiology. Mm-hmm. So let us not create these opportunities for people to encroach into us. And another very important element about leadership. When you are in a leadership position, you must know, you must be there to mentor other people. You see, we have so many experienced public health officers, but they have not cared to mentor other public health officers. That defines leadership. When you're in a leadership position, listen. You cannot know it everything. You cannot know it all. Listen to other people. Take time to listen. You might be having your own persuasion, but listen to them. In this listening, you will be able maybe to get something that you can implement, and that way everyone will be satisfied. And most importantly, don't take that office as your personal property. Know the time to exit. Know the time to exit. You can never be in that office forever. No, you have a certain period to serve. When it comes to a time to exit, by that time, make sure you have mentored other public health officers and honorably exit the stage, leave others to take the mantle. That is what I would encourage the leadership in public health. And if that is done, I'm telling you, in public health, we will be somewhere. One, I'm very happy about those that conceptualize these ideas and those that have meant it a reality, because now at this point, it's a reality. It's going to happen. This is a forum where we are going to share knowledge. This is a forum where we are going to share experience. And this is a forum where we are going to update ourselves on contemporary public health issues. So in the spirit of making sure we remain updated, of making sure we share our experience, I would call upon all public health officers as much as possible to attend that conference. I would be happy to see public health officers, to interact with public health officers in that forum. Thank you.